If you've been prescribed a pessary and you're wondering, how on earth am I supposed to put this inside my vagina safely, then don't panic. In today's video, I'm going to show you step by step as to how to insert a pessary safely and without any pain. So let's get started. Hi everyone, I'm Dr. Nabila Noor, a board-certified and fellowship-trained urogynecologist and a pelvic reconstructive surgeon, and welcome to our pelvic health community. In this channel, we talk about everything pelvic health without any shame or embarrassment, and together we learn about different aspects of pelvic health, different treatments, and how to make the best choices for yourself. So if you're new to the channel and like what you see, don't forget to hit the subscribe button and also share this episode with a friend. So many women suffer with pelvic health issues silently, and it doesn't matter what your age is. I have patients who are in their 20s and I have patients who are in their 90s. So there's a whole gamut of women suffering with pelvic health issues. Let me share a story with you. I had a patient who came to see me to be fitted with a pessary. And as we were talking, she was so concerned. And one of the questions she asked me was that, Dr. Noor, does the pessary not get lost in there? Spoiler alert, it doesn't. The vagina is a closed space. It's not that we put the pessary in the vagina and then it just goes into your abdomen and gets lost. It doesn't quite happen like that. So once we fitted her and she herself learned the technique of how to insert it easily, her response was, wow, that is so easy. Why did nobody tell me how to do this correctly? So let me be the one to teach you how to do this properly. So let's talk about, before you start, what are some of the things that you need. Number one is clean hands. You don't need gloves. You don't have to go crazy. Remember, the vagina is not a sterile area. As long as you wash your hands before inserting it, you should be fine. See, try to get some water-based lubricant so you can use it on the pessary, and that will help with easy insertion. Number three, of course, your pessary. For today's demonstration, I'm going to use a ring pessary with support. So as you can see, there's a little ring, and then this is the part that's known as the support. There are different kinds of pessaries. They come in different shapes and sizes. And so when we as physicians are fitting patients with pessaries, it's like getting fitted for a dress. We try different sizes, we try different shapes. I have another video that I'm going to link here that talks about the different kinds of pessaries that we use, so definitely check that out. And finally, a comfortable position. Many patients like to get their pessaries fitted laying down on the bed. Some people may do it sitting on the toilet so that they can access the vaginal area easily. And for some patients, it could be standing with one leg up on a step stool. Find a position that works for you. The idea is to make sure you are comfortable and you can easily access the area where the pessary is going, and you can do it properly and efficiently. Okay, so let's break it down step by step. Step number one, fold and compress the pessary. So a pessary is a vaginal insert that's made up of silicone. So because it's made up of silicone, it's easily foldable. As you can see, this pessary right here, I'm kind of folding it very easily. And usually for the ring pessaries with support, you will see that they have two large holes and some small holes. What I find easy for my patients is that if you fold it along the axis of the large holes, it folds much easier than trying to fold it on the other side. So kind of like this, and make it into a little taco before insertion. The reason to do this is that it makes it much narrower and much easier to put it inside the vagina as opposed to trying to force this thing in. Step number two, apply some lubricant, that water-based lubricant I talked about, at the tip of the pessary. I like to put the lube right at the tip instead of putting it all over, because what I find is that when you put lube all around the pessary, it can become really slippery and can be really difficult to hold with your gloved hand without slipping. So I usually put a little bit right at the tip, and if you can imagine, this is the opening of the vagina, and push it in. Number three, relax your pelvic floor. This is the most important and oftentimes can be the most challenging for a lot of patients. Obviously, you're nervous, you're probably anxious, you're already anticipating pain, so you tend to clench and tighten your pelvic floor muscles. And the problem is, when you're clenching your pelvic floor muscles, it makes the vaginal opening more tight and narrow, making it more difficult for the pessary to be inserted. Take a deep breath, try to relax your pelvic floor muscles, and the more relaxed that area is, the easier it is to insert the pessary. Number four, aim towards the back of the vagina. And what I mean by that is that when you're inserting the pessary, you kind of put it into the vaginal opening, and rather than going straight, try to put it towards the back of the vagina, almost towards your tailbone, which we call coccyx. Because the vagina is not a straight horizontal area. Once you kind of insert, there's a little dip that happens. So number 5, slide the pessary in gently. If you have lubricant right at the tip and you're aiming it in the right angle, it should go in pretty easily. You shouldn't have to force it in. If you're having to force it in, stop and then try to just change the angle so that you can find that easy groove where it can kind of slide in gently. And finally, number 6, push the pessary in so that it can slide behind the pubic bone. So if this is the vaginal opening, our pubic bone is right on the top. So when I'm putting the pessary in, the goal is to push it in and gently feed it completely so that it goes into the vagina, and finally push it in enough so that it goes behind the pubic bone, and that's when the pessary kind of opens up and you almost hear a little pop. Put your finger in there, make sure you feel the bone, and the edge of the pessary or the edge of the back part of the pessary feels like it's behind the pubic bone and not in front of it. Because if the pessary is not behind the pubic bone, then the edge of the pessary can be pushing against that pubic bone, and that can be really uncomfortable, not to mention it has a higher chance to slide back out. Something to remember, think of a pessary as getting fitted for a tampon. If done correctly, you shouldn't feel the pessary all the time. If you're feeling it or it's uncomfortable and you feel like it's sliding back out, chances are it's not positioned correctly. So hope you took notes, and those 6 steps that we talked about will enable you to insert the pessary like a pro in easy step-by-step fashion. So there you go. You've inserted a pessary. So the next question is, when should you call a doctor? Or what are some warning signs that it's not placed correctly? Number 1, persistent discomfort or pain. If fitted correctly, as I mentioned, it should not be painful. If it is painful, even after you've tried to position it, chances are you may need to see a doctor to reposition it, or maybe even try a different size of pessary. Number 2, new vaginal bleeding. Now, as you're putting the pessary, especially for my patients who are postmenopausal, because their vaginal tissue is very thin and dry, you may notice a little bit of spotting, but it should not be persistent bleeding. If you're having persistent bleeding, maybe there was trauma, maybe there's an area that's ulcerated, definitely call your doctor. Number 3, difficulty keeping the pessary in. If you inserted the pessary, but every time you're going to the bathroom, trying to push for a bowel movement, or with any kind of movement, walking, squatting, if the pessary is coming out, then time to call your doctor. Number 4, pain during insertion. As we put in the pessary, yes, it can be uncomfortable, but if you're in pain through the whole process where it's really, really uncomfortable, maybe a pessary is not the best option for you. And finally, number 5, urinary retention. Meaning you put the pessary in and now you're not able to urinate or have a bowel movement. A pessary, especially when inserted for pelvic organ prolapse, should make it easy for you to empty your bladder. But if you're not, and instead you're having difficulty emptying it, chances are the pessary may be too big and it's constricting your urethra, making it difficult for you to empty. So usually when I fit patients with a pessary in my office, once we have fitted the pessary, I usually tell patients to walk around the room, to squat, to bend, to make sure the pessary stays in. Because if it's the right size, even with movement or exertion, the pessary should still be in the right place. Now, if it's coming out when she's bearing down, she may need a larger size. Similarly, if she's feeling it when she's walking, moving, jumping, then that pessary may be too big of a size. It's kind of like getting fitted for a dress. We try a different shapes, we try a few different sizes, and then come up with the right pessary for you. Once you've been fitted with the pessary, I usually have my patients follow up in office in about 2 weeks to see how things are going. After that, I have many patients who like to manage their pessaries themselves, in which case they take it out every day or every few days or every few weeks and then wash it and then reinsert it when needed. Now remember, for most patients who are sexually active, we do recommend removing the pessary for intimacy because it may be uncomfortable for your partner, not to mention uncomfortable for you. I also have many patients who almost use a pessary on an as-needed basis. For example, I have many young athletes who notice that they have leakage of urine when they're going to the gym and use the pessary only before going to the gym, whereas at other times they remove it. If you like this video, then definitely do come back for the next week's video, because in the next video, I'm going to talk about how you can remove the pessary in some easy step-by-step fashion without any pain and discomfort. If you like today's video, don't forget to hit the subscribe button and do share this with a friend. Till then, stay well, stay healthy, and don't forget to take care of your pelvic health. Bye.